the absorption of drugs from the gastrointestinal tract are pH-dependent passive diffusion and gastric emptying time. So these are the two factors which affect the absorption of drugs, which are the pH-dependent passive diffusion and gastric emptying time. So here, what it says means both the processes are strikingly different in premature infants compared to with the older children and adults. So the process in the premature infants and in adults taking place will be completely different from the age. The next is in a full-term infant. Gastric pH ranges from 6 to 8 at birth. Gastric pH, you can see the difference in all of a sudden, especially in such kinds of pediatric population. Gastric pH ranges from 6 to 7 at the birth but declines to 1 to 3 within the 24 hours. So sudden change in the gastric pH can be seen in full-term infant after 24 hours of birth. So these are things that affect the absorption, especially in the GIT. Then says about the, in contrast, the gastric pH is elevated in premature infants because of immature acid secretion. That is the content here. Then what is saying, like studies have shown that the gastric emptying is low in premature infant. So as usual, we will be having these studies, especially about this population. So in such studies, it is said like the gastric emptying is low in such a premature infants. Then next is the drugs with limited absorption in adults may be absorbed efficiently in a premature infant because of prolonged contact time with gastrointestinal mucosa. So the drugs with limited absorption drugs may be absorbed efficiently. In adults, it will be limited absorption takes place. That is the difference here. Okay. We are discussing about the difference here. The drugs with limited absorption drugs may be absorbed efficiently in premature. It may work very good in premature than the adults because of the prolonged contact time with the gastrointestinal mucosa. Because of the prolonged contact time of gastrointestinal mucosa and drugs in the pediatric population. So that is what we will be here be discussing about in the absorption area. So many factors we have discussed here, such as the pH dependent passive diffusion and gastric emptying time. Then it is both processes are completely different from premature infants and adults. Then we discuss about the full-term infant gastric pH. Then the change in the difference within 20 to 24 hours. After that, we have gone to the drugs as those drugs limited absorption. Adults maybe have a strikingly fast absorption, or absorptive efficiency will be more in the premature infants. That's what we have discussed. The next, we can go to the next slide. Okay, then it comes to the intramuscular sites. As we have seen the picture here, a 90-degree way, intramuscular site, giving one dose to the patient here. So we can go through this slide. First one is drug absorption from an intramuscular site also may be altered in premature infants. Differences in relative muscle mass, pure perfusion to various muscles, peripheral vasomotor instability and insufficient muscular contractions in premature infants compared with older children and adults can influence drug absorption from the intramuscular site. Next is the net effect of these factors on drug absorption is impossible to predict. Phenobarbital has been reportedly to be absorbed rapidly, whereas diazepam absorbed may be delayed. Absorption is delayed. Then thus the intramuscular dosing is used rarely in neonates except in emergencies or when an intravenous site is inaccessible. So these are the other factors we can see here. Drug absorption from an intramuscular site also may be altered in premature. So the intramuscular way of absorbing the drugs also may change in the infants. The next differences in relative muscle mass. Muscle mass will be different.